patient has a discolored central incisor, which is non-vital and wants to improve the appearance, and a veneer is appropriate and the other teeth are unrestored, is a single veneer always best, or would you place veneers on the other incisors to match it? Really, Nicola, this is probably the most difficult aesthetic thing you'll face. The single anterior crown or veneer is really difficult to match. So first of all, get that across to the patient that the most difficult thing in dentistry is try and match porcelain to enamel and dentine. So always say to the patient, you will never get perfection with this because you've got a dark tooth first of all, and you're putting porcelain on it and you're trying to match it to normal teeth. It's not going to be perfect. So get that across first of all. So where can we start? The best place to start would be, if it's a discolored non-vital central, is internal bleaching. So do in-out bleaching, open the back of the tooth up, place something like a resin modified glass ionomer over the root filling. So drill out the gutta perca to below just gum level, put in something like resin modified glass ionomer, then bleach on the outside and the inside of the tray, and they put that in and they can change that a couple of times a day for 4 or 5 days. Maybe get them to basically do that maybe from Monday to Friday until the colour comes up. And then if that gives you an improvement of 60–70%, I advise most patients to settle for that. Problems, you may not get 60 or 70%. Fortunately, at the moment, I've been quite lucky. The last 3 or 4 I've done have been fantastic with a really good result. Sometimes they darken back down. Sometimes, admittedly, the results are disappointing. The results are often not perfect because what you're trying to bleach is basically the bruise within the tooth. It's not like normal bleaching. And the bruise basically has a lot of hemoglobin in it, which is iron-based. And these metal ions don't bleach well out of the tooth, so it can be disappointing. Then if you're going to veneer it, it's troublesome because the core is so dark. What you may often have to do is actually physically crown it and use something like Emax, but with one of the blocking cores. And when you do your prep, send a photo to the lab of the dark core underneath with something next to it, a shade A4 or something, so that basically the lab know what the shade is and they can try and match it. But be very almost pessimistic with the patient that you're not going to get perfection. Then if you're finding that it's really a struggle when you try it in, yes, really the next thing to do would be to veneer the tooth next to it. So if it's a single central, veneer the one next to it. But you would need to use a blocking core on the veneer, the same as the crown, so that it all matches in better.